This lesson will cover what a fertile period is, how to calculate a fertile period, and why we should know what a fertile period is. The reason you need to know your fertile period is that millions of women in the world experience irregular periods and hormonal issues, so that you can plan your pregnancy more accurately and when you're not planning to get pregnant. Therefore, knowing your fertile period can help you be proactive in preventing an unplanned pregnancy. So what is a fertile period? A fertile period is that period of your menstrual cycle when you have the best chance of becoming pregnant. Let's take a look at a few basics to understand the maximum. Most of the time the menstrual cycle lasts 28 to 30 days, though it can vary from 22 to 35 days. Since we calculate the length of the menstrual cycle after the first day of your period, we can write that the menstrual cycle typically lasts 28 to 30 days. Ovulation occurs when the mature egg comes out of one of the ovaries on the first day of your period. Ovulation usually occurs 14 days before your next period, which means that if you have a cycle of 28 days, the ovulation will happen 14 days before your next period. Normally, once the egg is released, it can remain fertile up to 2 days. When the sperms are released inside the egg after the intercourse, they can remain alive for up to 5 days. Thus, in a 28-day cycle, the fertile period is 2 or 3 days before the ovulation date and 2 or 3 days after the ovulation date. A woman's fertile period begins on day 12 and ends on day 16 in a 32-day cycle. In a woman whose cycle is 40 days, ovulation occurs on day 18 and the fertile period begins on day 16. Since ovulation occurs on day 26, the fertile period will be from day 24 to 28. However, this calculation may not work for those with irregular cycles or PCOD or other hormonal issues. A calculation of this sort will not work, and you also need to realize that someone with a regular menstrual cycle may find that the date of ovulation is pre-phone or phosphor, which is totally normal. So now let's talk about how to figure this out. Observe these signs and symptoms in your body to predict ovulation and your fertile period so that you can prepare for it. There is something known as a basal body temperature, so if you were to take your basal body temperature as soon as you woke up while still in bed, you hadn't eaten anything and hadn't drunk anything, then you would get this number. If we take your temperature during that time and continue taking the record, we can predict your ovulation, and just before the ovulation, it immediately starts to rise. If you are careful, or maybe if you are carefully monitoring that temperature, the temperature will increase until you get your pivot, and the temperature rise could be 0.5 to 1 degree Celsius. In fact, you can actually predict the ovulation using specially designed thermometers today. That is the second thing that will help you to determine when you will ovulate and when you will become fertile. A cervix is the mouth of the uterus. The cervix is very firm in the first half of the cycle. Prior to conception, the cervix is closed and hidden behind, but just prior to ovulation, the cervix opens up and slightly comes forward and upwards, allowing the sperm to enter the uterus more easily. Just after the periods, the cervical mucus is the discharge from the cervix and the vaginal glands, meaning there is no vaginal discharge. As you move towards ovulation, the cervical mucus actually becomes very thin, watery, and a copious amount just before the ovulation. It may be very thin just before the ovulation. In fact, you can stretch it almost 8 to 10 centimeters by taking it in your finger and stretching it like that. As well as the consistency, there are other changes to notice if you pay attention. Predicting your ovarian cycle with it, many women actually report having little pain in the lower abdomen before ovulation, referred to in German as metal smurfs, a term describing heaviness in the breast and tenderness in the breast right before the ovulation. She also becomes extremely sensitive to smell, and her sex drive diminishes slightly. She may also experience some vaginal swelling as well. As this, we can do follicular studies by using ultrasound examination to determine your ovulation date. In other words, we can determine your ovulation date by using fancy methods. Therefore, if you found this information helpful, please share it with someone who may benefit from it. I always feel that pregnancy should always happen by choice and never by chance, so being attentive to your body will help you plan your pregnancy when you are ready. Subscribe, like, share, and comment, and I'll talk to you soon.